If you're a patient with rheumatoid arthritis, you might have noticed that eating certain foods or having high stress in your life can impact on how you feel. In today's video, we are going to answer a question: how can diet impact your rheumatoid arthritis, and what are the nutritional changes that we can make to improve the symptoms and quality of life? Hi, I'm Dr. Ritakshi, and in today's video, we're going to dive deep into the relationship of rheumatoid arthritis and our diet. So before we get to the nutritional part, let's talk about what arthritis and rheumatoid arthritis are. Arthritis is basically a term used to describe the inflammation of joints. So the two most common types of arthritis include osteoarthritis and rheumatoid arthritis. Osteoarthritis is when there is wear and tear of the joints over a period of time. So as you age, you tend to get osteoarthritis. Rheumatoid arthritis is an autoimmune disease. In this, the body's immune system mistakenly attacks the synovium, and that is the lining of the membrane around the joints. So this leads to chronic inflammation and also it damages our joints. So the symptoms of rheumatoid arthritis include joint pain, swelling, tenderness, and stiffness. Usually when you wake up in the morning, you'll feel stiffness for around 30 minutes or so. Also, arthritis starts from your small joints of hands and feet and your wrist, and then eventually over time it can go to your elbows, your shoulders, and your hip and knees. We don't really know the cause of rheumatoid arthritis, but some of the risk factors include genetic predisposition, having any infective agents in your body. Getting infections can lead to getting rheumatoid arthritis. You could be obese, be under a lot of stress, or being a female. It's very important to notice the symptoms at early stage and treat the symptoms and get treatment for rheumatoid arthritis, because if you leave it for long term, then you can have deformities of joints and even have disability. Since rheumatoid arthritis is an inflammatory disease, it's better to have a diet which is anti-inflammatory, and in some cases, in some studies, we have seen that Mediterranean diet is helpful in managing the symptoms of rheumatoid arthritis, and also sometimes elimination diets such as of gluten or having a plant-based diet. These have also shown to be helpful in managing the symptoms. First, we have the anti-inflammatory foods. Now, in anti-inflammatory foods, we know that we have a lot of antioxidants, flavonoids, and these are all going to decrease the inflammation, and these are going to reduce the symptoms that you feel in rheumatoid arthritis. So first are berries. So berries like strawberries, blackberries, blueberries, and cherries, these are all antioxidants, and they are full of flavonoids as well. And these are all known to reduce inflammation in our body. Berries are also rich in vitamin C, and they have a lot of fiber as well, which are also good for your immune system and for your digestive system as well. So other fruits which have enzymatic properties, or they reduce the C-reactive protein in your body, include fruits like papayas, mangoes, and pineapples. Second are vegetables, specifically green leafy vegetables, which include kale, spinach, Brussels sprouts, and also you can include cruciferous vegetables such as broccoli and cauliflower. Now, these all vegetables are full of vitamins and minerals, and they contain lots of fiber in them. So they are loaded with vitamin A, vitamin C, vitamin E, vitamin K. All these vitamins and minerals are going to reduce inflammation in our body. Next thing that we should include in our diet is omega-3 fatty acids. Now, these are known to reduce inflammation in our body, and they are also known to reduce the swelling, the pain, and stiffness of our joints. First, we should have fatty fish. Now, fish like mackerel, sardines, tuna, trout, these are all good sources of omega-3 fatty acids, and they're going to reduce the inflammation in your body. Also, avoid shellfish because they have low amounts of omega-3 fatty acids. When you're having omega-3 fatty acids, make sure the ratio between omega-3 and omega-6 is favorable because omega-6 fatty acids are going to increase inflammation. Second, we should include nuts. Now, nuts such as walnuts, pecans, almonds, pistachios, cashews, peanuts, these are all good and high in omega-3 fatty acids. Nuts are an excellent source of fiber and vitamin E and minerals such as magnesium, phosphorus, and copper, and selenium. Now, these are all very important nutrients in bone health. Nuts are known to reduce our triglycerides and decrease our cholesterol levels. So they are also high in fat content, but don't worry, these fats are the healthy fats, which include monounsaturated fats. So these are proven to protect our heart and our health. So since they're beneficial, you can have at least one handful of nuts every day. Don't have too many because yes, they are high in calories. Next are chia seeds. Now, chia seeds are also an excellent source of omega-3 fatty acids. But what's more is that they are also full of fiber, and fiber is very beneficial when it comes to reducing our inflammation. Chia seeds are high in fiber, which means that our gut is usually going to stay happy with that, and it's going to keep our gut in proper function, which means this will lower the inflammation in our body. Also, if there's high fiber in food, that means you'll stay fuller for a longer period of time, and this will help you maintain or control your weight. Next, we should include in our diet legumes. Now, beans, garbanzo beans, lentils, edamame beans, soybeans, these are all good in reducing our inflammation. Legumes are a good source of protein, fibers, vitamins, and minerals. So in vitamins, they're a really good source of vitamin B complex. And also the minerals that are included are potassium, calcium, magnesium, zinc, and phosphorus. So high content of fiber and protein in your diet are going to keep your balance of insulin spikes. So if your insulin is not having big spikes, that means you're also not going to induce inflammation in your body, and that means you're also not going to get hunger pangs all the time. Your gut is going to keep itself busy and happy, and this will also help you feel fuller for a longer period of time, which means your weight is going to be under control. So having diet that is high in fiber and protein will help you fight obesity and will prevent from having diabetes as well. Next, we should include whole grains. Now, whole grains such as brown rice, wild rice, we can have quinoa, rye, gluten-free oats, and wheat. Now, these are all good sources of fibers as well, and lots of vitamins and minerals. Now, what we have to remember in this case is that if you have sensitivity to gluten, then we should avoid having gluten in our diet. Go for whole grains that are gluten-free. Sometimes your arthritis symptoms can flare up because of insensitivity to gluten. Whole grains are full of fibers, and as we have learned, fiber keeps you full for a longer period of time, so you will not get hungry, and it keeps your gut healthy. And because there's a lot of fiber, we will also have prevention of constipation. It will also help us decrease our cholesterol levels. So eventually, all this will help us decrease the inflammation and manage the symptoms of rheumatoid arthritis. In oils, we can have olive oil, coconut oil also, and avocado oil. So it depends on how you're cooking your food in high temperatures. You would use coconut oil. And if you're having it as a salad dressing or just to sprinkle on your food, have olive oil or avocado oil. Now, you know that these olive oils and other oils are good for your heart health. You know the benefits of them, but they're also helpful in arthritis. So olive oil has a compound called oleic acid, which helps you decrease inflammation. So that's why this is recommended to include in your diet when you have to manage your rheumatoid arthritis. Next are fermented foods. Now, fermented foods are a good source of probiotics. Now, probiotics are usually helping our gut in functioning properly and keeping it happy and giving it good bacteria. And this keeps the inflammation in our gut decreased. So, what are the sources of probiotics? They include dairy products such as yogurt, kefir, and buttermilk. Other foods that could be fermented are usually cabbage, which is known as kimchi. You can have sauerkraut. You can have a drink of kombucha. And in India, we can have fermentation of beans and whole grains, and we can have dosas, idlis. So including fermented foods in our diet would decrease the level of inflammation. Lastly, we could include some spices such as turmeric and ginger. Now, these are good properties of anti-inflammatory, antimicrobial, and they're also antioxidatives. So having this in your diet can really reduce the symptoms of your rheumatoid arthritis. It can decrease swelling, the pain, and inflammation of your joints. Foods to avoid or limit. So we should avoid processed foods or sugary foods because these are high in salt, high in refined flours, sugar, trans fats. These are all going to increase your inflammation. So have them in moderation, and if possible, do not consume processed food, packaged foods. Now, if you have any insensitivity to any of the foods that you're eating, that you have noticed that your body is not able to digest or to tolerate such foods, then only can you go for elimination diets. Now, elimination diets, you can eliminate gluten. You can go on gluten-free diet. You can go on meat-free diet. You can go, in this, you can avoid red meats and focus only on lean protein sources like poultry, chicken, fish. You can also go for dairy-free diet. And these are only if you feel that your body is flaring up after having certain foods. Otherwise, focus on having a balanced diet and having a proper healthy diet. So lifestyle changes that will help you improve your symptoms of rheumatoid arthritis include keeping off your stress. Don't take so much stress because stress will increase the inflammation in your body. And second is to exercise. Now, exercise is actually going to help you with the stiffness of your joints. So the more you move, the more your joints will have rotation of movements, and the more they'll open up and feel less stiff. So in the beginning, you might feel that exercise is not for you because you're feeling more pain. But don't start with high levels of activities. Go for a 5-minute walk, increase it to 10 minutes to 15 minutes, and so on. So you can build your stamina of exercise. And of course, you can also exercise in the gym if you are able to. Always listen to your body, how it reacts to the exercise you do. You can do even weight training, cardio, yoga. These are all helpful in treating the symptoms of rheumatoid arthritis. So the stiffness and the swelling of your joints will go down. Conclusion. Make sure you listen to your body. Your body will give you enough signs that which foods are triggering your rheumatoid arthritis. Have a food diary so you can know that this food I should avoid and this food is okay for me. So while your diet alone cannot treat your rheumatoid arthritis, but a well-balanced diet, which is filled with anti-inflammatory foods, can help you manage your symptoms of rheumatoid arthritis. Thank you for watching and learning about how diet can play a significant role in managing your symptoms of rheumatoid arthritis and improve the quality of your life. So if you found this video helpful, please make sure to like this video, share it with somebody who has rheumatoid arthritis, or just with your family and friends for awareness. And don't forget to subscribe to my channel for more videos on nutrition and health. Thank you for joining in. I'll see you in the next one. Bye.